and welcome to the Dr. Bob Show. Does anybody at your house snore? Do they snore loudly? Do they make the walls of the house rumble? When they're snoring, do you ever hear them stop breathing? That's called sleep apnea. People that snore loudly frequently have obstructive sleep apnea, and that can harm somebody's health. It can cause high blood pressure, mental fogginess, automobile accidents, poor performance, a lot of medical problems. I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. And our guest to learn about a new guy on the block. A new guy on the block is a new procedure that will help eliminate obstructive sleep apnea. My guest is Dr. Jaron Densky, board-certified ENT physician trained in a procedure called Inspire, a new procedure. Could you be a candidate? Could it save your life? We'll be learning on this show. A lot of information for you. We're talking with Dr. Jaron Densky, board-certified ENT physician, and we're talking about the new kid on the block, the new procedure that may be the answer to obstructive sleep apnea treatment. Jaron, welcome to the Dr. Bob Show.
Thanks, Dr. Bob. Thanks for having me.
What is sleep apnea?
Yeah, so in general, most people, when they say sleep apnea, what they mean is obstructive sleep apnea. So what that is they go to sleep, and as they sleep, the muscles in their throat and their tongue relax. Their throat will collapse down, okay? So either the walls or the tongue falling back, and their lungs are still trying to breathe, but the air can't get by, and so their oxygen level drops, and that leads to a whole host of possible health conditions that it could cause.
What are some of the things that it could cause?
Yep, so it can cause a risk of high blood pressure, diabetes, could cause heart failure, atrial fibrillation, risk of heart attack and stroke.
So it's big time stuff. It's not something that we just blow by.
It is not, and it's certainly the worse the sleep apnea, the higher the risk you may develop those things. And not only that, people often won't feel well, like they are unrefreshed during the day. They may wake up with headaches and have those types of issues, so it's important to treat.
I'm just tired all the time.
Exactly. Yeah, and you snore, and it might interfere with your bed partner.
Yeah, so if somebody snores loudly, are they more likely to have obstructive sleep apnea or just snoring?
Yeah, so we say if you have snoring, you may have sleep apnea, but if you have sleep apnea, you definitely snore. So, yeah.
No. Are you able to generate life-changing situations by this new procedure we'll talk about?
You are. I think if you're the right candidate, if it's right for you, it's all about patient selection, it can produce tremendous results.
So what procedures are available to stop snoring and obstructive sleep apnea?
Yeah, so there's a variety, and I would say first and foremost, not a procedure per se, but if you do have sleep apnea, you're inevitably going to end up in a sleep medicine office, and you're going to have a sleep study, and you'll probably be recommended to try a CPAP or a BiPAP, and you should try that, right? It's a very important first step because that's the gold standard.
Do they usually work?
Well, if you can wear it and you can tolerate it, it is very reliable. And so certain people, it may not, but the vast majority it does. And so it's important to work with your sleep doc, try different masks, try different settings, different machines. If you're not doing well, you might need a titrated sleep study where you go into the lab and they will wear the mask and vary the pressures to figure out what works best for you. And so you actually can have an opportunity to try different things.
So where is the main problem with somebody that has obstructive sleep apnea? Is it the tongue? Is it the back of the throat? Is it the tummy? What is the main problem?
Sure. Yeah, there's a lot of things that contribute. Certainly, as you say, the tummy, it matters with weight, but a lot of what happens is it's the amount of the neck circumference and the amount of tissue around your throat.
Yeah, people say, if I remember correctly, it was a 17-inch neck.
17, correct, yeah.
So why is that important?
Yeah, well, the more tissue you have here, the more what we call fat around the throat you have.
So it squeezes in
and
on
it
the...
squeezes down, especially when your muscles relax. There's more pressure going in. And so when I think about it, we look at 4 different areas. We look at the back behind your palate, at the area behind your tongue where the tonsils are. We look at the back of your tongue and where the little flapper valve called the epiglottis is. So all of those sites can contribute.
Can you visualize all those things when you have a patient in the office, you put them in the examining table, and you look with a scope?
Yeah, and you can see all of those. It might not replicate what their sleep is like, so there are certain maneuvers you may be able to try to get a good sense, but it doesn't replicate exactly when they're awake.
What is Inspire?
Yeah, so Inspire is something where it's called hypoglossal nerve stimulation. And so what that does is there's one of the cranial nerves that supplies the motor movement to your tongue, and Inspire takes that and stimulates that nerve while you sleep. So the way it works is there's a sensor on the chest. There's a little implant that's like a pacemaker. So the easiest way to think about this is a pacemaker for your tongue.
So pacemaker for the tongue on the chest?
Yeah, just like a pacemaker, it goes over here on the right side. And the way it works is you turn it on, it gives you time to get to sleep, and then once you get to sleep, every time you take a breath, it's going to make your tongue stiffen up so it's not falling back to block the airway.
Does it automatically do that with every breath, or?
It does, every breath.
So when it's doing its job, then the tongue should not be one of the causes of blockage of the air blockage.
Correct. So whenever your tongue is not falling back, that gives you room to breathe. You don't have the apnea. You don't have the reduction in the airflow, so you sleep a lot better. But it's important to know to make sure, hey, that the tongue is the source of the problem, right? Because if you're somebody who it's just the walls of your throat and not the tongue, then we have to adjust the treatment options.
Can you reduce the size of the tongue? Can you manipulate the tongue surgically? Does that help the person?
Yeah, so, people in the past have done tongue-based reductions. That's where they take out kind of a middle wedge of the tongue. And that has variable success rates, and it has a higher risk. And so I don't personally do that, but I think that some people still do.
So my son is an ear, nose, and throat physician, and he's always mentioned that if you do the tongue reduction or take off part of the back of the tongue, it's really quite dangerous, or could be dangerous, could be life-threatening, and you could lose that patient. So you have to be very, very careful in your selection on that. How about a dentist pulling the jaw forward, mandibular advancement?
Correct, yeah. So, there's a couple of ways that people do this. You have the dentist aspect where you wear a mandibular advancement device, and that will pull your jaw forward while you're sleeping. That's a good option for typically people who have mild or moderate, some cases of moderate sleep apnea. It can be very effective. I tend to recommend everybody try it if they're willing. Some things that can happen is if somebody has bad TMJ pain, which is very common with sleep apnea, then it might exacerbate that. So that's something you have to be wary of. But beyond that, there's the other surgical procedure that an oral and maxillofacial surgeon might do. And what that is
oral, mouth, and maxillary surgeon.
Correct. Yeah, OMFS.
Might do what?
And they may do maxillomandibular advancement, where they actually will break your jaw and move it forward. And that is a very effective, but it's just not as commonly employed just due to some of the recovery and risk associated with surgery.
Hard to break somebody's jaw and fracture the maxilla?
Yeah, well, it's something that has more, I would say it's hard because they wouldn't tell you it's hard, but it has more morbidity associated with it. But I think the whole essence is that there are very effective treatment options that are easier to go through as a patient, and they're more reliably effective for patients. And so that's what we're looking for. We're looking for something that is not really hard to go through, but it's also very effective, but you have to select the right patients.
So who is a candidate for Inspire?
So
And that's what we're going to be talking about when we come back. New treatment, Inspire. Are you a candidate? Do you snore? Is it harming your health? Do you have hypertension, high blood pressure? Do you have problems with a rhythm disturbance in the heart? Do you have obesity? Are you getting type 2 diabetes? Lots of things that can occur just because you have obstructive sleep apnea. Let's see if Inspire is made for you. We're talking with Dr. Jaron Densky, board-certified ear, nose, and throat physician, and we're talking about a procedure called Inspire, the new kid on the block that may be the answer for people that have obstructive sleep apnea. That's where the throat actually stops breathing because of several causes, but when that happens during snoring, if you stop breathing, it can cause problems with high blood pressure, type 2 diabetes, irregular heart rhythm, and in general makes the person very dysfunctional. So now we're talking about a new procedure, Inspire. What is Inspire and what does it do and why is it going to be good?
Sure, and so it's colloquially called a pacemaker for your tongue, okay? So,
The tongue pacemaker.
It is, yeah.
So the tongue's important.
The tongue is very important.
What does it do during sleep apnea?
Yeah, so your tongue will fall back, so the muscles of your throat will relax, and the tongue will fall back, and sometimes the walls of the throat will fall in. And so if we can prevent the tongue from falling back, we can fix a lot of the sleep apnea, and it depends on each individual patient, but that's how Inspire works. And so what it does is every time you go to sleep, you turn it on.
Turn it on. What is it?
So the way it would work for a patient is they have a remote. It kind of looks like a computer mouse, and you can't control it from across the room. It has to be in contact with a pacemaker type device that is inserted on the chest, and so you turn it on. It has a delay, which is programmable, and so it allows you enough time to get to sleep, and then once you're asleep, it activates. And then every time you take a breath, there's a sensor here, and as it detects that you're taking a breath, it will make your tongue stiffen up and move forward just a bit.
That's
so
amazing.
It's not blocking the airway.
How'd they do that?
Well, a bunch of smart scientists
guys?
and engineers. Yeah.
So it's just not as simple as putting a fish hook on the back of the tongue and pulling it out during the nighttime.
No, there's not many people's wives that would want to do that for them.
So when it is activated and when things in the back of the tongue, you say stiffens,
The muscles of the tongue will stiffen.
and that opens up the airway, or doesn't let it close.
Doesn't let it close,
Yeah.
yes.
So how instant does it work? How
Yeah, so
successful?
just kind of a guide through it. So it's for people that have a BMI less than 35. They
That
have,
means a BMI of 35 would be overweight.
yeah, their weight. So they can't be too overweight, okay? The smaller you are, the better it works, okay? You have to
Age?
have age at least 18, okay? Secondly, you have to have at least moderate sleep apnea, okay, and severity.
How do you determine whether it's moderate, mild, or severe?
So you get a sleep study, which is often done in the sleep lab, can be done at home as well, and then you see how many times per hour you're having a respiratory event. And so if you're having it enough, which is like the number is 15, so 15 or more, then it's at least moderate or severe sleep apnea.
And so you might be a candidate for Inspire.
So if you're not too overweight and you have at least moderate, and you have to have tried CPAP. I mean, I tell all my patients, hey, you should try CPAP. It's very effective, it's non-surgical, but there's about a third of people who just can't tolerate. And so they end up back, and those are the people that I can help.
When I see people in my office and they talk about a CPAP and they talk about using their CPAP, almost 100% will say, I don't like it, I don't use it. It ends up in the drawer. It was a useless expense to me because they don't use it. Is that a common answer that people give you?
It is, and I usually kind of push back a little bit and I say, hey, well, just because you don't like it doesn't mean you shouldn't use it, right?
So how would you encourage somebody to try it again?
Well, I make sure they've tried different masks, okay, different places with a hose, And they also can try to go for a sleep study where they will modify the settings as you sleep to see what's most comfortable. And they might want to try a BiPAP, right? So some patients need a BiPAP experience instead of a CPAP.
So what's a BiPAP?
Yeah, so it changes the level of pressure from when you're breathing in to you're breathing out. And it can be more comfortable for patients. And so those are the things I encourage people, but ultimately some of them end up back to me and they say, hey, I just can't use it. I've tried my hardest, I just can't do it. And so if they have all of those things, we will evaluate them to make sure that their tongue is part of the problem. And if their tongue is a significant part, then they then would become a candidate for Inspire surgery.
More common in men or women?
So sleep apnea is absolutely more common in men. And CPAP intolerance, I would say that it's fairly equal about what I see.
What are your requirements for hooking that patient up with Inspire?
I just want them to understand what they're getting into, right? And I kind of lay all the options out on the table. And then if they understand it and they definitely can't use a CPAP and they pass all the screening tools, then we say, okay.
So it looks to me like you're pushing the patient away from the procedure that you're a super pro at. I'm calling you a super pro.
Well, thanks, Dr. Bob. But, no, I'm not an Inspire salesman, but I think it's a very effective technology if you're the right patient. So I don't want to push a patient away from it, but I also don't want to bring somebody in who could just make a few adjustments and tolerate a CPAP.
So walk me through doing the procedure. You talk about the chest wall. You talk about specifically the right side. You talk about hooking it up somehow with a nerve that controls the tongue. So where do you attack?
Sure. So in general, it's an outpatient surgery. You go home the same day. It takes about 30 to 45 minutes to put in.
Do you make an incision in the chest or you make an incision in the neck?
Both. So you have 2 incisions. So
how big are they?
So the incision here is 3 centimeters, so just a little bit over an inch. And the incision here is 4 centimeters.
And you could sew it up where it didn't leave a scar on my neck?
Yeah, it hides very well. It looks very, very good in the end. And so you go down, you have to retract a couple of muscles to get to the nerve that controls the motor movement of your tongue. And it's important to note there's no sensory capability here. So it's not a shock, not a zap. If a patient experienced what it's like, it would be like a muscle twitch, okay? So you put the electrode cuff around some of the branches to the nerve. You don't want to put it on the branches that make your tongue sit back. You want to put it on the branches that make it stiffen and move forward, okay?
That really interests my brain, saying, how do you figure out which one's which?
Yeah, well, some of it is your eye and your experience, but you also have tools to help map it, and you have a nerve monitoring machine to show you. And so you put electrodes in the tongue into each set of muscles so you can tell which one you're activating.
I can remember in medical school, around the curve came the lingual nerve, accompanied by the hypoglossal. So are we talking about in that area?
Yes, sir, right in that area. And so you go down and you find it. If you were to look a little higher, the lingual nerve's higher. So hypoglossal nerve is just a little lower, a little bit easier to get to from that respect. So you put it on, and then after that you make a small incision on the chest, and I go down to your pec muscle, your big chest muscle, okay? And then I go through it, I feather through it, and I get down to your chest wall between the ribs, and I put a sensor between the intercostal muscles, okay? And that's the medical term is a piezoelectric sensor that senses movement, okay? And then the brains of the operation sit here on top of the pec muscle, and then you have to tunnel the wire from here down to here, and you connect it in. And then what I do is I test it. So I put it on, I test it, I make sure it sticks your tongue out. After that, I turn it off, and then you go home.
When you bring the patient back for follow-up, what are you looking for?
So I usually see you, a week or 2 after, and I want to make sure, hey.
And that's what we're going to be talking about when we come back. Well, what do we expect 2 weeks later? How effective is it going to be? How does the doctor know if the surgery has done exactly what he wants? I think it's amazing. You want to stay tuned. Hello, I'm Dr. Bob Overholt. here to encourage you and your family to get out and play in our Knoxville area parks. Knoxville has dozens of parks and more than 85 miles of trails. There are picnic shelters, ball fields, tennis courts, and disc golf courses, dog parks, fishing ponds, and skateboard parks, trails for hiking and mountain biking, boat rentals, you name it, Knoxville has it. To find a park or greenway near you, visit OutdoorKnoxville.com. And get out and play. It's good for your health. We're talking with Dr. Jaron Densky, board certified ear, nose, and throat specialist, and we're talking about a procedure called Inspire, a procedure that hooks up to the tongue eventually with an electrical stimulation that keeps the tongue from closing down on the airway. It has to be battery powered.
Correct.
How long does that battery last?
Yes, the battery lasts 11 years.
11 years. So at 11 years or around 10, somewhere in there, what does the patient begin to experience if it's not working as good? Can they tell?
So the device can be monitored to how often it's being used and what settings, so it would just show that it's not working, and at that time the entire thing does not need to be replaced, but the battery itself would have to be replaced.
So how do you replace it?
Yep, so you would just have to go back in and you would unhook the couple of wires, you'd put a new one in and hook it back up, and it would be
as good as gold.
Yeah, 15-20 minutes and you'd be good to go.
It looks to me like the negatives of doing an Inspire would be, are there any negatives? You don't want to do this.
No, sure. Well, again, I think one, you have to understand it's a surgery. There's general surgical risk, bleeding, infection. We do have to dissect the tongue. There's a very low rate in the literature of having some temporary, just for a few weeks, weakness of your tongue. But beyond that, you have to understand it's a device. In theory, I've never seen it, but a device could fail, right?
Sure.
But all that's very low risk. From the standpoint of what's the important negative to understand is that this is a process. And it is not get it and turn on overnight. It takes time and it takes commitment with the sleep medicine doctor as well as with your sleep surgeon. It's a collaborative effort. I couldn't do it without them and they couldn't do it without me. So we work together and it takes you a few months to go from point A to point B to where you're ultimately going to be.
How does the patient know or feel or experience that they are responding?
Yep. So initially when we start it, we don't expect you to feel improvement right away. Okay, but as you go, you start to say, you know what, I'll wake up, I feel a little more refreshed. I'm not having those headaches. You know, my bed partner tells me I'm not snoring as much. I have more energy, right? And so that's how they will initially notice. And then it becomes to the question of, well, okay, you're making improvement, but where exactly are we?
How do you tell that?
Yeah, so around that time when we think you're doing better, you're in the ballpark, okay, we bring you in for a sleep study where we actually use the Inspire device while you sleep, and we'll adjust the settings to go from a lower to a higher setting to see how it's impacting your sleep apnea.
If somebody has the Inspire procedure and it obviously appears to be working for them, they're going to spread the word. How often does somebody come into your office and say, I want that new device that stops my apnea?
Well, it's about every day. So it comes in all the time, and a lot of it is from people who see it on TV. Some hear it from somebody who's had it, and some is through talking to their sleep doctor to see if it's appropriate for them. But this is something that I see on almost a daily basis.
So it looks to me like the more and more that the name of the procedure is apparent to people out in the public, the greater number of people that are going to want this procedure done. Is that an accurate statement?
No, I think that's right. And it's ultimately our job as the doctors and health professionals to see who is it right for, you know?
And as I'm listening to you, I'm seeing you say, before we get too deep into the Inspire, that we need to be sure you've tried a CPAP and you've tried other things and they failed. And to me, you should do well and you should be a good candidate for this. Any stories that you have of somebody that said it changed their life?
Well, yeah, some of the things that I enjoy hearing patients talk about is the fact that, they used to go and they would travel. And some people, there was somebody who wanted to do a long segment of the Appalachian Trail, right? And they go out and they backpack and they just didn't have anything to treat their sleep apnea. And they felt terrible and they couldn't make it through. And so after we implanted them with Inspire, they were able to complete a long segment backpacking hike. And so those type of stories are on the fun side, but in general, most people just are very thankful for the fact that, you're helping them feel better on a daily basis.
I think that's such a great statement that you just made, that the people appreciate that they've improved, that they've gotten better, it's changed their quality of life. I want to truly thank you for coming to the Dr. Bob Show.
I appreciate you having me.
And explaining to us what Inspire is and who's the candidate and what they can expect. Wow. Now remember, I'm not going to let you get out of here without remembering those 4 things. Number 1, we've got to be exercising. I guess you can get your neck stronger and where it works better. Be sure you're getting 7.5 hours of sleep. That's what it's been shown that most people need to get adequate rest. What you eat determines on the body's metabolism. You have to be able to feed with right food. And most of all, what do we like? Is that laughter in your life. Laugh a lot. Don't forget to laugh. Don't forget that that's part of enjoying yourself as a human being, is laughing, and you'll stay healthier.